Hi everyone, I'm Mark.
And I'm Marize, and welcome to our channel.
We are Filipino doctors who graduated from the UST-FMS, and in this video we will share about our experience on how we studied through the AMC MCQ exam, which we recently passed this year.
Everything we say in this video is based on our experience and opinions and may not be applicable for everyone. Okay, so without further ado, let's start.
This video is divided into 9 parts, so feel free to use the timestamps to skip ahead. We will discuss the following.
So first are the books recommended by the AMC, such as the Handbook of MCQs, the Anthology of Medical Conditions, and the John Murtagh. We will also discuss on recalls and Q banks such as Amedex and MPlusX.
Next, we will also discuss about the guidelines, whether or not you should have a study partner or enroll in a review center.
And we will also discuss the recommended duration of study as well as our timeline.
The Handbook of MCQs is one of the recommended books by the AMC. Their questions are structurally similar to what you would expect in the AMC exam.
The rationale in the AMC is also good, but make sure to cross-check with the recent Australian guidelines since this book has been published a long time ago. Some people also say that some of the questions are repeated, but for our case, there wasn't any. But even then, do not memorize any questions for the AMC.
Make sure to understand the topics by heart and also answer the questions and then read on the rationale at the end of each chapter. You may go through this book once or twice.
The John Murtagh is another recommended resource. We use the John Murtagh to read on topics as we encounter them while studying. The information in John Murtagh is concise and easy to understand, and we don't really recommend on reading this from cover to cover unless you have lots of time. And there are also diagnostic triads there that are really helpful.
The Anthology of Medical Conditions is also one of the recommended books. It has many pictures and it helps you differentiate on the possible causes based on symptomatology. However, in our case, we were not able to finish this, but we made sure that we went through all the pictures just to be more familiar with it.
Using a Q bank is a must for the AMC MCQ. Popular Q banks that you may hear about are the Amedex and the MPlusX Q banks. Both are really good in our opinion. I use the Amedex.
And I use the MPlusX.
But choosing either one will definitely help your review. For a quick comparison between the two, we will do a separate video on that.
To be notified, don't forget to click the subscribe button and the notification bell. Q banks are important because they help you focus on the common scenarios and topics that you are most likely to encounter in the exam. The rationales are comprehensive and guidelines-based, but always make sure to counter-check them.
Based on our experience, there could be a few inconsistent questions, so the best practice is always to check the recent Australian guidelines and articles.
There are circulating questions that allegedly came from previous exams, but there is no reassurance in this. You will later on see that these questions lack information and can be confusing. We recommend that you do not use this as your main resource, and please don't memorize the questions and choices.
If you encounter these recalls, we recommend that you study the topics thoroughly, such as the usual presentation, the diagnosis, treatment, and management, as well as check the recent Australian guidelines. You can do this with a study group or a study partner.
So as we mentioned, the Australian guidelines are important. These guidelines are easily accessible when you Google them. Make sure to also read the latest articles about the topics. Important guidelines are the post-exposure tetanus prophylaxis, the recommended and routine vaccination for indigenous and non-indigenous people,
Screening for common cancers such as breast cancer, colon cancer, cervical cancer, melanoma, and other skin cancers, common topics like DVT, pulmonary embolism, drug-drug interactions, and more. Examples of these are the following. Having a study group for the AMC MCQ is a big help, not just for studying, but for emotional support as well. Studying for the AMC MCQ is stressful, and at times you may feel lost and confused as to whether you are studying right. But having a study group can help keep you accountable and motivated to study.
You can also discuss pictures like ECGs, chest x-rays, CT scans, and dermatological lesions together. In our case, we studied together most of the time. We made sure that before we go to bed, we asked questions to each other to reinforce the topics. We did not sign up for any review center since we recently passed the Philippine licensure exam, so we still had our notes with us. However, there is a well-known review center here in the Philippines called Amedex.
The duration of study for the AMC MCQ depends on how much time you are willing to commit to studying. We recommend around 3 to 4 months of focused studying. Focused studying for us means studying for an average of 8 hours a day.
It also depends on your study style, but you can probably dedicate a longer time in studying to balance it with your other priorities. But for us, we had to take some time off in order to study. It took us around 1 month to make our EPIC and AMC account as well as to verify our credentials. We answered the Handbook of MCQs for about 2 to 3 weeks depending on whether you take down notes or not. And then we studied the QBank for 3 to 4 months and then 2 weeks to a month of group study.
The AMC pathway is challenging and the exam itself is very expensive, and we all know that dedicating most hours of your day every day for months can be very exhausting. So don't forget to reward yourself every now and then and to not be so hard on yourself.
At first, studying the AMC is overwhelming, but keep on pushing because it gets better. In time, you will get used to the type of topics they give. Do not get discouraged by what people say about the passing rate because AMC is very much doable.
Also remember to study the topics by heart because they twist the questions around to check if you really understand them. Remember also that your study for the AMC matters because you will be able to apply them once you work in Australia as a doctor. That's all. We hope that this video was very helpful for you. Please keep in mind that everything we said here is based on what worked for us and may not be applicable to everyone.
If you have any questions, comment it down below and we will do our best to answer it. We wish you all the best in your upcoming AMC MCQ exam.
Thank you.
Bye!